Shut the fuck up and sit down. I'm trying to help you, right? Right? With an axe. Getting out of bed, if we have PowerPoint here, I actually had pictures of actual tourniquets on plates on patients. Yes, I have permission to use them. One of them is completely severed foot. It's an 82-year-old female who got out of bed, stepped down on the floor, and her foot broke off completely. Oh. The only reason she's alive, her daughter was on her way to pick her up, take her to church. It was on Sunday. She lived close to the EMS station. Me and my partner were stationed at, which happened to be close to a hospital. We found her. She was unconscious, unresponsive. I'll never forget, a big tan shag carpet, bright red. They estimated she had lost about half her blood volume. If another probably minute, she'd have been dead. This happens. Chainsaws, all these things. This is what happens. And this is a piece of equipment. How many people here have taken CPR first aid? It's important, right? Everybody pushes it, right? This. Do you know what your chances are, cardiac arrest out of a hospital setting, your survival rate is? When I show up as a paramedic, you know what your survival rate is when we start CPR, give all fancy things? 10%.
90.
7% survival rate. You know what your survival rate is if you put this on and stop bleeding?
70.
97%. Now, I'm not saying knowing CPR is not important, but this is just as important. This will save a life. Those IFACs everybody carries and everything in it. If you've got the fancy the chest seals, if you've got the needle, all those things, those conditions you're going to use them for, you're going to die in 5 minutes or less if you develop those conditions. This is the most important thing. I carry a tourniquet with me every single day on my body everywhere I go. This is a soft tee. I also carry cats. Yep, I don't carry rats. I don't carry anything. Yeah, they're smaller and everything. These work. I know these work. I'm not saying anything not to get a rats if you have one or a TK4. I'm not. I prefer these. I've used these. I know these work. What's the Army issue? Got turned. What's the Marine Corps issue? Soft tee. Forces, what do they use? Everybody who goes into somewhere where there's a bigger likelihood of something happening that a tourniquet can be used, this is what they use. It's known, they've got 20 plus years now of knowledge and data that says for this. How many people actually carry a tourniquet every day? Do you practice with it? Could you get it out, put it on yourself in 30 seconds or less? So order one of the cheap ones off Amazon. You're sitting around watching TV, doing whatever. Practice it. We used to, I worked over, so we would just play games. Didn't matter where we were. Somebody would come in, they'd throw a tourniquet at your right leg. Do it. You have 30 seconds to do it. So you can make it fun, but this is something you need to practice now. I'm not saying if you don't get it on 30 seconds, somebody's going to die. You should practice. It's not just for yourself, but it's putting on to people. And there's techniques. All right? Techniques. A few things you put a tourniquet on. Has anybody ever placed a tourniquet here on somebody? Have you done a real one? Somebody who's actually has an injury, put one on. What do they do? When you put that tourniquet on, what happens? When you start cranking it down. Was he conscious? Most people will tell you the tourniquet hurts more than the actual injury. It does. It's going to hurt a lot. And when you put it on, they're going to scream, take it off, take it off, take it off. They're going to scream, they're going to fight. So I can tell if somebody's ever really put a tourniquet on somebody, more than one, because as they do it and they start tightening it up, they're doing this. People swing, they kick. because it hurts. And I hate to say it, bitch the whole time while it's on. Take it off, it hurts, and they'll tell you it hurts more than the actual injury. But it's saving their life. Suck it up. It's not fun. You don't want to hurt people, but it's going to hurt. But you're saving them. That's what is going to keep them alive, breathing. Questions so far? All right. So, you get your tourniquet. A lot of people raise their hand and say they have a tourniquet. Still in the package? So how many people, be honest, how many people still have their tourniquet? It has this nice plastic wrap on it. Alright, so I want you to do something. A lot of equipment, a lot of stuff I use, I'll just give you a little tip. Even the little packages, chest seals, everything, if you've ever seen people who've been around a lot of stuff, you put tape tabs. No, I didn't invent this. I had an 18 Delta teaching this. And I believe they still teach it in 18 Delta school. So you take some tape, put little tear handles up on it. Why? Because when you're dealing with somebody and there's a lot of blood, what happens to your hands? Go stick your hands in motor oil and then try to do something. It's the same thing. So, having that in a package, you try to take this out of the package with hands covered in blood, doing whatever, it's never going to happen. Have it staged, have it ready. Now, when tourniquets come, they all do it. Don't ask me why. But 90% of the time, it's packaged like that. So you get it out of the package, you get the plastic off. Now you're doing this, but you got to put it around something, right? Stage your tourniquet. Now here's a little tip. A lot of people, you can do it, fold it. There's a billion ways on the internet. Everybody, skinny medic, correct medic, this medic, that medic, whoever has ways to stage a tourniquet. I don't care how you do it, as long as you have it. What I will tell you, there's a great little trick I was taught. Take the end, fold it over on itself on the Velcro. Bring enough down to where it's the length of the tourniquet. Usually you'll fold it back up on itself. I'm doing this messy as shit. Oh my God. Fold it up, now it's nice and flat, but the reason you fold it up like that and do it that way, and you've got something to grab, especially if you have to self-deploy. Get a nice big handle. You can put it good tight, you give it a good purchase. But I can crank this. And how many cranks? We want to sit here and crank on this thing for a while? This is what we want. I do not have a radial pulse right here. The blood flow is cut off. How many times did I crank it? Boy, did you watch when I was putting it on? How hard did I pull? Put it on. Quick. Come on. Let's go when you wait. All right, please. Go ahead. Don't take those out. It's okay. No hurry here. No sense of urgency. Let's go.
Okay, let's show her how to crank it.
I was told by an old medic, he was an instructor, he said, you crank it till they start yelling and then crank one more time. Now, how many people put it on and you had to pull this way? When you put it on, have that tail that you're pulling toward yourself. Why? More leverage. Get it tight. Did you notice when I put it on and then crank it twice? Look at my hand. See? It hurts. But I only cranked it twice. because when I pulled towards myself, I yanked it down, I was able to get it real tight, so it's quick and simple. So as you're self-deploying, you're putting it on to yourself, pull towards yourself. You're going to get 10 times more leverage. Make sense? Now, placement. Let me get a little blood flow back in my arm. So placement. Turn a little circle. All right. You know it works. You know I'm not bullshitting. I actually did crank it down. Two ways we place a tourniquet. A hasty or emergency tourniquet or a deliberate tourniquet. Now what's the difference? How many people have heard, oh, you take the tourniquet and you put it on 3 inches above the wound and then that's where you take it down? It's a deliberate tourniquet. You can do that. Will it work? Yeah. Here's the thing. You're in an emergency situation. If you're not used to seeing arterial blood, and what's arterial blood look like? It's going to squirt out, right? All that bullshit you see on the movie constantly squirts out like somebody turned a hose on. That's what it is. It's bullshit. It goes with your pulse. As your heart beats, it squirts out, but it's going to be bright red. It's oxygenated blood. That is the blood that has circled through your heart and your lungs. It's been reoxygenated. The air you breathe in goes down your lung and your heart. Molecules attach. I won't get through the whole thing, but it goes into the blood and the arteries pump it to the rest of your body. That's how your organs, your brain, your toes, your fingers all get oxygen. That's how your skin, what's your largest organ?
Maybe for you guys.
That's how the end of my finger, it gets oxygenated. See that blood through the arteries. Veins return to the heart. That's deoxygenated blood. It's taking all the crap out in the trash, right? So, that's how you know it's arterial blood. It's going to spurt. It's going to be bright red. So our placement, we want to go, you have arteries all through your legs and your arms. We're only going to use a tourniquet on extremities. You may be tempted to use it on somebody's neck. I'm not saying they don't deserve it, all right? Technically, I have to say that's not what they're used for. I can't stop what you do in your own private time.
You have an extra battery. 9?
So, when you place a tourniquet, what we want to do is go high and tight. I'm sure you've heard that before, right? As high as you can go, as tight as you can go. Tight until it's no longer spurting. We've shut the water off, right? It's plumbing. That's all we're doing. We're plumbers. What do plumbers do? I've got a leak. Well, let's stop the leak first, then we'll fix it, right? That's what we're doing. It's no different. So once we put that on, we want to go high and tight. Why do we want to go high on the legs and high on the arms? How big is my artery here compared to up here, or my femoral artery compared to a pedal artery, which is in my foot? Big, right? So think about it. I put a tourniquet here, right? I still have all this pressure shooting down through here, right? So you've got that pressure and everything, so the best thing to do is just cut it all off. Just like plumbing, right? You've got that whole line of plumbing, you've got a leak way down here, but the water cutoff is back. You just cut it all off through the whole thing, right? Same thing. You cut that off, and here's the other thing. What if it's down on my ankle? I put a tourniquet right here. If you do that 2 or 3 inches above the wound, right? How many bones do I have here and here, my lower arms, compared to my upper legs and upper arms? 1 bone. That you've got to compress down with that artery. You've got 2 bones in the lower part. It's harder to occlude those arteries putting a tourniquet on. So we do a hasty emergent tourniquet because it's easy to remember, right? High and tight. We're just going to stop the blood. Oh, wait. You might get tissue damage. There's no blood. You're going to hurt it. Look it up yourself. You don't have to believe me. Documented cases. 27 hours of a tourniquet applied. And that's not that fantasy. For 27 hours, there was no tissue or nerve damage done as a result of the tourniquet placement. Now, ideally, you want it 2-3 hours, we want to try to remove it. Because can it cause a little bit of damage? Yeah. The way I look at it is you're alive and your arm hurts the rest of your life. Well, you've got something to bitch about.
One of the things I like to show in my EMT classes, I'll throw one of these sons of bitches on early in the class, and then wear a sleeve over it. About an hour into the presentation, I'll take my sleeve off. It's like, you've been wearing that the whole time? Yeah. Check my pulse. Like, ain't nothing there. So right now I had Caleb put this on at 4 o'clock. We're at the 5-minute mark. Look at my hand. All right. Starting to change a little shade of color there.
Oh, sure shit is.
Yep. But look.
Yeah.
What I do for a test is I'm right-handed, but I can unlock my phone, find one of my contacts, calling my lovely wife right now. No issues. No issues whatsoever. How do you like that?
You could still bleed and use your arm. Unless it's severed off, you could still use it, all right? The thing is, you can put it on, and what he's proving is it can be on. You saw how long did I have it on? You saw blood, you already started to see the color change, right? But the thing is, when you put a tourniquet on, it's technique. So pull hard as you can get it. Secure the Velcro, and watch. One. And I'm doing this non-dominant hand. I'm left-handed. And I can feel it. That's 2 turns, right? No pulse. 2 turns. It's how you place it like that. I'm doing it myself. Why did I deliberately? You saw me shift it around so I can have the most fulcrum on this twist I can get a hold of. If it's sitting back here, try to twist that and get it secured where it's on the back of your arm or underneath. I pulled it towards me and kept it close to my body. Why? Right? I'm going to get the most pull, the most strength by doing that. If I'm pulling out here, do I have as much strength as I do keeping it close to my body? No. So I'm able to tighten it down then. 2 cranks and that's it. You can already see the difference. Good way to test is you can do your fingernail where the tip of your, if the color doesn't return within 2 seconds, there's a compromise. All right? So crank that down. Leg is the same way, high and tight. Now here's the thing. I can put it on. My arm and still keep a loop, right? You can bend your leg up and do, I'm 51, I'd be lucky to touch my damn toes. I mean, I can, but it's an effort to get back up. So you may have to completely take it off, right? But it's the same thing. You want to be able to pull this towards you, put it around, and all you're doing is you're going through here as hard as you can, and then twist. The good thing about your leg, if you still got both arms, whatever your injury is, you can. Now, a leg is going to take longer. It's probably going to take you 3. Your whole idea is you don't want 3. All right?
Oh, you gotta move a little ball action out of the way too.
Yeah, that's, we're going to go.
Not him. He's good.
We're going to, yeah. 51 again. I don't have to worry about that anymore. Divorce, no sex life here. This is my sex life. No, I'm divorced. Try dating my.
Oh, she kept them.
No, yes.
One of the things I like to talk about with tourniquets on legs, how many of us wear cargo pants in this crew? Right?
Yeah, I thought you were
Right? So when we're doing this, I'm going to put this hand tight on Chuck.
Yeah.
We got here. Back of the hand, front of the hand. Get that shit out, rip it out, throw it on the ground. Put that tourniquet on. Then wind that son of a bitch down.
Yeah. Remember, people scared, especially this group. Prepared, right? Got a lot of shit in your pockets, right? Right? That's going to get in the way. It's going to be harder to occlude. Get the stuff out of their pockets. And also for men, which way are they hanging? You know, seriously, you got to be careful because it's happened. Guys get in, it happened a lot in the military. Guys get excited, they're throwing that tourniquet on. Oops. You're going to know because I'm sure they're going to scream even louder. You gotta make sure nothing in the pockets, anything on the legs. Arms too. You know, you've got now all the little combat shirts and a lot of shirts made with the pockets up on the arm. Make sure that shit's out of it. So we're gonna go high and tight, both ways, right? We're gonna crank until there's no more bleeding. Don't worry about it. There's no circulation. Now, wait a minute, it's oozing. I see out of this wound just oozing a little bit. It's still going to. You know why? You've got capillaries. They're still gonna go. It's very hard to tamponade it. As long as there's anything. You still see bright red stuff coming up, let's stop that. Now what happened? I've got the tourniquet on, I cranked it down as hard as I can, the bleeding's still going. What do? Put another one on, right below. And crank it down. I highly recommend, like I said, the windlass tourniquet. Now, there are different types. Oh, she got it, okay.
Oh, you want it here?
Yeah.
While there's a
I just
pause,
want to show.
we're at 10 minutes. Hi. My arm's still there.
How does it feel though?
After about the first 3 to 5,
You don't feel it.
Good enough.
yeah.
So why?
He'll have a bruise, I'll have a bruise. Tomorrow.
I had one on my arm. It hurts like hell.
Yeah. Now imagine you've got an injury, and when you crank it down, some of these guys, especially in the military and stuff like that, you get cops, you know, any cops in here? 'Cause I'm getting ready to insult you. All right? Cops, what are they? They're puffed up. You know, they live in the weight room, right? Everything. You know, they're meatheads. They look like freaking gubbins. And you know what? Cops can use it. Use a cop. All right? And I say this with affection. I'm a tactical medic. That's why I'm allowed to say this and make fun of cops. But when you put a tourniquet on, they crank it down. And I mean crank it down. They're strong and they're excited. They're not used to, and most people aren't used to seeing that blood. They're not used to it. Going, holy shit. Bad. You get excited, you get your butt. That's why you practice it. Why do you keep practicing doing this? How many people carry a gun? Practice with your gun? You practice drawing? Muscle memory, right?
Let's break this
Muscle
down even-
memory.
Let's break this down even more simple for some of us that don't carry a gun and you're younger or just don't for reasons. How many of you can tie your shoes? How many of you can tie your shoes in the dark? How many of you are too lazy to tie your shoes and have zippers? Hi, I'm that guy.
Paramedics. Easiest, laziest thing that can be done, we'll do it. So, there's different tourniquets out there. Rat's tourniquet, TK4, some people teach them. The thing about these tourniquets, they're great on adults. Smaller children, they suck. All right? These are great for kids. You know what these are also great for? Your dogs, your cats, canines. They work great. Those tourniquets don't work. The SWAT team tourniquet, I'm sorry I don't have one here, but he's got them out there. Looks like the big stretchy band, wide band and everything. It's not a primary tourniquet. It makes a great pressure dressing. It also works great on canines, and it works great on kids. Yeah, here's TK4. It's an elastic thing. I don't like them. I don't suggest them. Some people have them, but they also work great on kids. Elastic, you can get down and wrap. It's just really hard with the hook. It's a technique.
If you don't mind.
No, go ahead. Go ahead.
Okay, so on little kids, like I'm a mom, so I only carry the stretchy tourniquets because I'm always with my kids or my dog Momo. So the hooks are the hardest part of the TK4s. So I take them completely out of the equation and just do it like you're tying a shoelace. And then just go around. And once you get it tight enough, you can do it again, go through here, or go around and connect the hooks together. And the hooks don't bite into your kid. You don't have to take the time to try to figure out how to hook it. You can't do that on yourself on your arm, but you can do it on your legs. I will say, I don't like using the TK4s on adults because I've seen them snap, but for little kids, they are incredible and they're less painful because of the wide berth than the rats. I carry a rat tourniquet for a couple of different reasons. One, I'll let you take that off. One is because they are extremely strong. They're stretchy. They work on my kids. They work on my dog. And you don't lose any progress with the rats. So, do you want to come in? So, putting the rats on.
If anyone's wondering what I'm doing here, these sometimes will take and swing around. So I have her look away, put her hand up and protect her face. And we're cutting.
So for the rats, like the way that you carry these, you just put your hand through here, and then you're gonna pull that through there and move it up. If something happened right now, I can get this in there and stop what I'm doing. So if I have a bus full of kids, because like I said, I'm a mom, like that, my first thought is always my kids. If I have a bus full of kids, that took 5 seconds. Every other tourniquet here that you will use will take upwards of 15 to 30 seconds. If you've got 10 kids on the bus, how long does it take to bleed out? 3 minutes. You're not gonna get to all the kids in time. How many, I can get to every kid on the bus in less than a minute for 10 kids with the tourniquets where I don't lose my progress. And then I can come back.
And these aren't made for kids. I
Yeah.
mean, they're not. These are made for adults. It's made for the military. That's what it was for. So they can't get down for smaller kids. Now, putting one on somebody else. Also a couple techniques. We still stage it, right? We're still going to stage our tourniquet, have it ready. All right. Fold it up flat, fold it in a manner, put a little rubber band on it. I use a rubber band, stick in my pocket, that way I can just pop a rubber band on it. My tourniquet's ready to go. Now, I'm gonna go stick one on his arm. He's got an injury. So the first thing I'm gonna do is, what I do is once I get it out, put it on the opposite arm, like this. So I'm gonna go up, and yeah, he may hurt, whatever, doesn't matter, he's bleeding to death. I don't care if it's called it's in pain. I grab it, now grab it there. Now there's two things. When I do this, I put the windlass on somebody else back here. Why?
I can't reach it.
I can't get to it because they're not going to like it. And then I'm going to put it on. And secure that little strap, pull it across, so that way the windlass doesn't come out. And then what I haven't mentioned is we're going to note the time. Surgeons like to have the time. It doesn't really matter, but we're going to put the time on there, all right? But mark it, that's important. So you see how easy that was, right? I grab, I can throw it up, you get it on in just seconds. Do the same thing with the leg. They're laying down, pick the leg up, loop it all the way up and go. Tighten it down. Now, we've got the tourniquet on. We've done what we need to do. We're starting to do everything. What do we want to do? He's all amped up, right? Shit, I'm bleeding to death. All amped up, adrenaline's going, everything. We lay him down. He calms down a little bit. What do you think's going to happen within the muscles and the nerves and stuff of this extremity when it's injured? Tightens up, right? It's going to tense up. So he starts relaxing. What do you think those muscles do? They relax. So I'm going to go and reassess. Oh, do they have a pulse back? Is it bleeding? I'm going to make sure that tourniquet's still tight. All right, because by now I may put a pressure dressing or something. If he's got his laceration, I may pack the wound, but I'm going to check it, right? So we want to reassess and constantly reassess. He's not going to like it, but I like to put the windlass as far back as possible. For that reason is because they're going to want to take it off, and they're going to grab at it. And you may be busy, maybe you've got more than one patient. If you're the only provider, 2 patients is a mass casualty. It is. It's more than what you can handle. Because one patient, even for me as a paramedic, I pull up as a critical care paramedic. A critical patient, and this would be a critical patient, I'm done. That's less than one. Technically.
Would you say it's technically what?
Technically, I'm what?
Technically.
Oh, you're the care provider, somebody who's trained. 2 patients, that's a mass casualty for you.
Mass casualty is an event that overwhelms any system or municipality.
Or your resources, your available resources.
If you're your own first responder and you have multiple, there you go.
So that's what it is. So most of the time, I would say 75–80% of the tourniquets that I've placed on people have been chainsaw accidents, hatchet accidents, old lady getting out of bed, breaking her foot off, car accidents, things like that. Have I done stabbing, gunshots, stuff like that? Yeah, I have. Explosions, yeah. It don't happen very much. It's not. But I've worked in places, gone overseas, stuff like that, where it's more common. But here, regular streets, everyday stuff. How many IEDs have you seen gone off in the last 2 weeks that you're around or anything? No. How many people have used a chainsaw in the last week?
Even overseas, your lacerations are way more common. You hold on to Humvee.
Yeah. Accidents happen every day. Shit happens. Murphy's Law is always in effect. So be prepared, be ready. Have your tools, but practice with it. You get the training. Know what to do after the tourniquet. Because guess what? As soon as this injury happens, I'm placing a tourniquet, whether it's on myself or somebody else, they're in shock. You're not preventing shock. You're not going to put them warm. All you're doing is trying to keep shock from getting worse. As soon as that leak happened in the body and all that stuff, your body goes into override. Oh shit, I'm transferring everything into that area, or because what happens is, there's a problem, I've got to keep the organs alive. Your body starts shunting resources away from your skin. That's why people, they get cold, oh, I'm cold, they say they're in shock to the cold, it's the blood loss. No, the body's doing it on purpose because it wants to keep this alive. It wants to keep the heart, the lungs, the vital organs. That's what your body automatically does. As soon as that injury happens, that leak happens, you're in shock. Plain and simple. So we're going to keep them warm. We're going to do those things. We're going to pack wounds. We're going to put a pressure dress. Learn that stuff. Make sure it's from a good, reputable educator, okay? Somebody who knows what the hell they're doing. Check their background. Do all those things. Just like I said earlier. You know, you're not going to go and you're not going to get whatever plumber, HVAC, you know, your HVAC says, you're going to check around. You're going to make sure it's TAD, right? Buy the equipment. $25, hold on just 1 second, I'll get you. $25 right now with Drums Emergency Solutions. Whether it's a cat tourniquet or a soft tee, he's selling for $25. Most of the time they're $30. I've seen soft tees going for $32, $35. Guess what? They're actually deploying troops right now, stuff like that. These will be in short supply. You want to know why? Department of Defense called up North American Rescue. We're deploying troops. I'm going to need extra tourniquets. They're going to call it up whoever owns Quick Lock now. We need more of that. We need this. They'll be on short supply. It happens. Because guess what? They've all got agreements with when the Department of Defense calls. We need shit. You're giving it to us first.
Here's a question for you. Those that do medical, have been around medical, have ever played with one of these, and by the way, we're at 25 minutes on the cap, and here's a tip for you. Tourniquet's still applied, still got full sensory. I can do everything I want with it. How many of you have heard, oh, I'll just use my belt? Bullshit.
So for me, when I'm teaching people to do tourniquets, one of the things that I say is if like only somebody else takes off the tourniquet that you put on. And the reason for that is if you've seen the YouTube video, the guy that taught disarms and then he got robbed and he took the guy's gun, then handed it back to him. And it took him multiple times of handing the gun back before he was like, shit, okay, this is mine now. So I don't want you to train yourself that, okay, this is starting to get uncomfortable, we pop it off. So I always have somebody else do it. Now, if you're the only one in your home and you're wanting to practice tourniquets, I tell people go to a designated spot in your house, have a mantra that you say like, I'm safe, this is training, now I can remove my tourniquet, to give yourself a couple of roadblocks so that you don't accidentally go into taking it off.
You want to practice with it? Hold on, let me give her a question first and I'll get yours.
I'm not against this, but what is the timing thing for?
Why do you write the time on?
Yes.
So the surgeons want to know the time the application of the tourniquet. It originally went on that because these were going to the military. They were in Iraq and Afghanistan. Their evacuation times may be a lot longer. It may be 4, 6, 8 hours. They also want to know, could it be doing some tissue damage? It gives them an idea of what else to look for, okay, on things like that. Here in the modern world, if something happened, somebody went down, somebody grabbed one of his tomahawks and sliced somebody with more artery, we slap a tourniquet on, ambulance will be here fairly quick compared to that. That's what it's for. To be honest, like I said, there's plenty of documented cases of tourniquets being on 10, 12, 18, 27 hours without any damage.
So there's no ever any reason to relieve pressure?
None. Never. You don't do it. Once it's on, it stays on. That's why you put this band on and you leave it. The only time you're going to touch this tourniquet is if those muscles relax, you did your reassessment and bleeding stopped, we want to tighten it some more. Okay? Once it goes on, it stays on. Don't touch it. Pretend it's not there. Now, your patient's going to let you know. All right? They're going to yell, scream, cuss, get it off, get it off, get it off. Or put it on. The other thing is we never want to put a tourniquet over a joint, a knee or elbow. So that's why high and tight. At this level, you're going to call for help, it's high and tight. And leave it. You're compressing all the arteries, you're cutting all the flow off, so you know once it stops, there's no pulse, we've stopped the big red bright stuff coming out, we're good to go. They're going to live. Let them bitch, let them yell, let them scream. They're alive. Make sure it's staged, make sure you get it, spend the $25. How much is a funeral? $25. Don't buy the cheap ones that I've passed out, the Chinese ones. $25. These work, it's worth it.
Those age out, should we check them at certain times?
Yeah, check them. It's just like anything else. Nylon, if you get it dirty. You want to try to protect it? I carry mine in a pocket every day. You know, John makes holsters and stuff for them. If you want to carry it on a belt, gear, or whatever, you want to stick it on a sling. You want to put it, attach it to your chainsaw jack, stuff like that. Whatever the case is, you want to check it. Make sure there's no dirt, sand, whatever, grit, because dirt and grit will get in here and it'll wear the nylon. All right. Once it wears the nylon down, it compromises that. Do we want to trust it? No. So you inspect it.
I wanted to reinforce something and then ask y'all to speak to something. You know, he's saying, you know, you should have this, have the training, have the stuff, and be ready to put it to effect. I was a groomsman at my best friend's wedding, and I was the first responder to a plane crash. I was the only responder to a multiple casualty plane crash. And I did not have tourniquets. But the people in the plane were totally in shock and they weren't cooperative. Can you speak to kind of the attitude that you have to have with someone who's in shock? When they don't want to cooperate, they're like,
Make them.
I'm sloshing.
Yeah, you could try talking to them, but remember something. They're in shock. They got an altered level of consciousness. They're not thinking straight. It's like a diabetic when their sugar gets low. It's the same thing. They're not the same person. It's like somebody who's stoned, somebody who's drunk, right? Think of it that way. So, but you need to help somebody. I've literally said, suck it up. Shut the fuck up, lay down, and let me help you. Sit still, I'm trying to help you. Sometimes that's what you have to do. What are you going to do to your kid if your kid's talking back and you're trying to do something they're hurt? What are you going to do? Shut the fuck up and sit down, I'm trying to help you, right? It's the same thing. It's the same exact thing. You're trying to help them. You got to put them down, put hands on them to try to help them. Do it. They're not going to do it. Well, they're probably going to thank you. And here's the thing. You're still covered on the Good Samaritan law. You're still covered. Don't worry about that bullshit, oh, can I do this? Just like teaching medical stuff. I'll be perfectly honest with you. I think you should know how to close wounds, do stitches. I believe somebody's learning that. IV. Yeah, IV, stuff like that. Technically, can I tell you to do that and go out and start IVs on people? No. What they don't know, fuck them.
That's what they say about us.
So know how to use it. Know how to do it to take care of your family, to take care of you. So when you can't go to the hospital, stuff's not available. It's the same thing with everything else.
Man, I'm talking about realest, one of the realest to try.